From hero to zero, and claps don't pay the bills. Some of the chants by nurses here and across the country on strike again in a dispute with government over not just pay, but patient safety. Emma has been a nurse for more than 3 decades.
For a long time we've felt we haven't been able to give the care we want to give because we're so pressed for time, resources, simply just numbers on the ground. So I think for a long time we've wanted things to change, and it's come to the point where something has to change, and this is really our only option. Nothing else is working.
The reason behind that, more than 10 years of underfunding and neglect.
Across the country, the health service has been facing what's been described as an intolerable and unbearable strain due to a combination of COVID, the seasonal flu, and staff shortages, with some patients having to wait up to 24 hours for a bed inside a hospital, such as this one.
That plus a record 7 million patients on the NHS waiting list, described as a national scandal. The Royal College of Nursing Union demanded a 19% pay rise when they first went on strike last year, but has since cut that in half. Yet a deal is yet to be reached. The Health Secretary, James Cleverly, says the strikes put patients' lives at risk. Last week, the government introduced legislation that, if passed, will enable employers to sue unions and fire employees if they refuse to work on strike days.
Rather than talking about the pay negotiation, talking about safer staffing and the safety and quality of care that we're giving up and down the country in our hospitals, the government have gone down this sort of anti-strike, anti-trade union route. So once again, so it's interesting to talk about safe staffing levels on a strike day, but what about the other 365 days in the year when we have not enough nurses on duty, not enough doctors, not enough physiotherapists, cancellations of operations and delayed chemotherapy? What about those days? What about safer staffing on a normal NHS day?
The UK has been hit by months of public sector strikes from rail to mail, all of whom say they're in for the long haul. In the weeks ahead, more strikes are planned by nurses, paramedics, and ambulance drivers, with the Royal College of Nursing warning it'll be their biggest walkout yet if pay talks with the government do not progress soon. Saeed Purza, Press TV, London.